So where should we start? Obviously, last night the UK went into lockdown. We all got our text this morning from the government telling us to stay at home. But there still seems to be a lot of questions about what lockdown actually means and what we should all be doing with these new measures that are being put in place. Could you shed some light on that and what should we all be doing?
Sure. So I think there needs to be some more clarity to this. Obviously, it's a very significant change. It's when you step back and think about it, it's really extraordinary, right? That we're shutting down almost every aspect of society apart from critical infrastructure in a way that hasn't happened, I guess, since World War II. Um, at the same time, it was kind of overdue. And when it was announced last night, I just first thing I said was, "Hallelujah! It's about time." And I thought of the apocryphal phrase attributed to Churchill that Americans always do the right thing, but only after exhausting all other possibilities. Here on the flip side. So it's great that it's happening. It's unfortunate because it was unnecessary that we got to this state, but it's very necessary that we do it now. What's really important is that we do it well and we do it right, because we're about to make enormous, both personal and then collective economic sacrifices. And if we end up with a half-baked sort of effort at lockdown, as kind of happened in Italy in the beginning and some other places, it's just not going to have the effect we needed to. And so why make these sacrifices and still have sort of cases go up and deaths go up and in the NHS be overwhelmed? So just to kind of run through the main guidance as I understand it, we're all to stay home, period, full stop. For those of us who are critical workers, those are healthcare workers, those working in healthcare settings and pharmacies, those who are doing deliveries, those who are responsible for critical infrastructure like certain types of transportation and maintaining the grids, et cetera, those kinds of things should stay open. For the most part, everybody else should stop working out of the house anyways, and to stay home. We are told not to go out of the house at all, with a couple of exceptions. One is getting outdoors for a bit of exercise once per day. We're not told how long that can be, when that can be, but you can get outside and do some exercise as long as you're not coming within 2 meters of other people from outside of your household. That means not taking your kids to the playground, but you can go out for a walk or a bike ride or just to run around in some open space and get some fresh air, get some exercise, keep your sanity. Then the second thing is to go out and do sort of essential shopping when you have to. And that's really just kind of food, household goods, medicines. And when possible, it's really advisable to have those things be delivered instead. Other than that, you are to stay home. Now, there's been a lot of confusion about what's a critical worker, who are not critical workers, or essential workers, I think is the term actually being used. And particularly for the 20% of the UK population who are self-employed or 0 hours employees, who don't at the moment have any kind of protections, they probably feel pretty critical because, if they stop working today, there's no paycheck and there's no way to put food on the table. And so we understand the government is working around the clock to put measures in place to support vulnerable folks, particularly workers in those situations. But it's unfortunate they weren't able to bring that out the same time they announced the lockdown.
And Peter, we now have 1.5 million people who are being told in the UK to obviously stay at home. They're the most vulnerable. They're supposed to stay at home for a minimum of 12 weeks. Does that give us greater grounds for optimism in terms of the trajectory of the virus in the UK? Because obviously you've got the UK in general in lockdown, you've got our most vulnerable, hopefully safe and secure. What could that mean for the trajectory of what we could see for the virus in the UK?
What gives me more cause for optimism is not that just that the segment of the most vulnerable are being kept home for that long period of time, but that we're all being kept home, right? So keeping home the most vulnerable reduces their risk of getting infected, which is important because we know their mortality risk is much higher than those who are younger and healthier at baseline. But what's really going to turn the tide of the spread of this virus is the much broader kind of societal social distancing, which is coming from the lockdown. So it should work. It will take some time to work, probably a couple of weeks before we start to see any change. You got to remember that a new case being identified today or a new person being hospitalized today was infected a week or two ago. And so tomorrow we're going to be seeing things that happened a couple of weeks ago. And we weren't really doing very much, frankly, to slow this thing down before the last week. So we should expect cases to continue to go up at a pretty significant and kind of continue to be alarming rate over the next days and even the next couple of weeks. We won't know how well the lockdown is working until at least about 2 weeks from now, which is why it's kind of curious that they talk about this being 17 days or 3 weeks or something, because that's just maybe barely the time at which we'll start to see an effect. But that's the part that gives me hope. Again, I wish we weren't here, or I wish we had gotten here a little bit earlier before the genie was out of the bottle, but it is where we are now, and the best thing we can all do is to really try to respect the lockdown and adhere to it as best we can.
And going back to what you were just saying in terms of these 21 days, India today went down to lockdown, and they again have said that it's locked down for 3 weeks. What is this number 3, and where does it come from?
I don't know exactly. As I said, again, it's going to be 2 or 3 weeks before you start to see any kind of effect. India doing this today was a big deal, right? This is a country of 1.3 billion people, and a lot of people who are living on the margins or below the margins in terms of poverty, vulnerability, food insecurity. And so that's a major step to be made. And India is much earlier on the epidemic curve than the UK and most European countries, than the US, etc. So I think there's probably some merit to the idea, and let's try to get this under control first. But it's a really extraordinary step. I don't know exactly where the 3-week idea comes from. I think any leader is going to be wary of sort of saying, we're going to lock everything down for months and months and months, and you want to give yourself some room to be flexible. And one could be hopeful that you're going to turn the tide and the number of new cases are going to come down and you can gradually sort of ease up. I would be astonished if that were possible within a 3-week time period in any of these settings. If you look at sort of what's happened so far, there are some countries that avoided lockdown entirely by being smart early, like South Korea, Japan, Singapore. But everywhere that's had to resort to lockdowns has had to continue it for longer than 2 or 3 weeks. So my suspicion is that certainly here and other European countries, it's going to be a longer period when we're going to have this very significant kind of shutting down of society. Places that are earlier, like India, may not have to be on lockdown for so long, but that's a big, complex kind of setting. I think it'll be difficult to implement that effectively. So hard to say, but this is not going to be quick. I think it's just leaders not wanting to overwhelm people by, they want to give themselves flexibility.
And there's been some articles in the news today in terms of Italy sort of peaking with its number of cases. If that's the case, does that leave you optimistic in terms of what the UK can expect to see?
Yeah, so what we've seen in Italy over the last couple of days has been the number of new infections plateaued and then has dropped each of the last 3 days. Now we're still talking, I think about 5,000 or 6,000 new infections per day. So it's significant. There were something like 700 plus deaths yesterday. So this is still a red hot burning epidemic in Italy, but we have seen, at least for the moment, what looks like a peak and now a little bit of a decline. So we can hope that means that they've hit that mark and that they're starting to come down. Remains to be seen if that will be sustained. Worth noting that we're now 15 days into the national lockdown in Italy and about 4 weeks since they locked down the northern part of Italy, which is where the epicenter was. So that gives us a little bit of a sense of the time course that we might expect. That 2 to 4 week range might be a place we could start to see at least a leveling off. We start to see some effect from this lockdown. So we can only hope and pray that this will be sustained in Italy. It's important that they don't pull back on the measures that have gotten them this far just yet, because of course they're not out of the woods. There still are thousands of new cases. There's active transmission happening, but we're starting to see that, hopefully that decline.
And today the IOC announced that the Olympics were going to be postponed for a year. Obviously, the Olympics weren't due to take place until later this year. What does that look like then for the future of other large-scale events that are due to be held in sort of November, December, even the beginning of next year? Obviously, the next big COP is due to be happening in November. What can we expect to see from these large-scale events, and are they going to go the same way that the Olympics has now gone?
Yeah, the Olympics, I think, was the last big domino to fall, at least in terms of sporting events between now and the end of the summer. It was inevitable. It was something I called for about a month ago, and it got to the point where obviously it's not going to be safe. They had talked about an athlete-only Olympics, but of course, many athletes have had significant disruptions to their training because they're locked down and they're trying to take care of their families. And so it just got to the point where it wasn't feasible. And I understand they're talking about postponing it for a year. That seems to be the case with a lot of big events. Euro 2020 was postponed for a year, etc. I would say that within the next 6 months, it's probably pretty tough to imagine big events that are going to bring folks from different parts of the world together happening. You go beyond about 6 months and get into the last few months of 2020, and it's still probably a question mark. So it's not surprising to me that events in November, for example, are still saying, well, let's take a little bit of a wait and see approach. Hopefully we'll be in a better place, at least in many parts of the world by then, but it may be different in different places. I don't know how back to normal we will be. So these are the kinds of things where the goalposts are going to continually being moved, but there's just too much uncertainty.
And let's hopefully move to a little bit more of a positive outlook. Since we last spoke to you on Friday, are there encouraging treatments that you've seen come out that could be really a cause for hope?
There's been a lot of talk of this malaria medicines, hydroxychloroquine and chloroquine. I saw some reports, unconfirmed, say that the FDA had given approval for it to be used in a compassionate use thing. I'm not as sorry. Here I am turning good news into less good news again. I'm not as chuffed about that as President Trump seems to be. I'm not sure why he's latched on to that particular one, because there are a number of different drugs that have anecdotally shown either a little bit of clinical effect or a little bit of laboratory effect. But this is one of, between 5 and 10 different drugs, some old ones like chloroquine, and then some new ones, including some antivirals that were kind of sitting on the shelf after having been developed for Ebola or other kinds of viruses in the past, that are showing some promise. I mentioned last week also this really interesting serum antibody therapy, which might have the ability to be a preventive. That's now being developed and tested in laboratories on at least 3 different continents. And we've got a dozen vaccines in the pipeline. So there's no breaking news on that front. And I'm always a little bit wary when you sort of see the announcement that, aha, we got something, we did something no one else has, because it's usually the company themselves announcing it and they get a boost in their stock price. So there's cause for optimism, but nothing really game-changing, at least since last week.
And can you explain a little bit more about the successes in sort of South Korea and Singapore that you mentioned? What did they do that was so successful? What could we be doing here? And does that include the kind of increasing in testing that we hope to see happen more here as well?
Yeah, so the most important thing they did, which we didn't do here, was act early and aggressively, right? And that early action before you start to see a big surge in cases is really important, because the tried and true public health measures, testing, isolation, and then tracing of each infected person's contacts and surveilling them is much easier to do when you have dozens or hundreds of cases. It's very difficult when you have thousands of cases, because it's a lot of sort of people power that's required to do that. So the early action was a big bit of it, but there are a couple of components to their interventions that are important and still really relevant. The first is test. And I'll come back to why this is so important still in the UK, in the US. And then using that test to trace contacts. What South Korea did was actually use GPS tracking through phones of both cases and their contacts, so they could see where they are, where they're going. They would know how to reach contacts if their test came back positive, et cetera, et cetera. And so they have sort of massive intelligence about where the hotspots are, what the chains of transmissions are. And what that allowed them to do was the second big type of interventions, the social distancing things here. Here we're doing a lockdown, which is like a blunt instrument, right? It shut all of society down. If you have the kind of precise intelligence that widespread testing gives you, and you're a little bit earlier, you can say, this city and that province are hotspots. We need to really aggressively lock those down, limit travel in and out, and we're going to try to interrupt the spread there before it spreads everywhere else. And so you can be a bit more targeted. South Korea never did a nationwide lockdown. Singapore never closed its schools. So they were able to be smarter and kind of with surgical precision do their social distancing because they had the intelligence. This is really important for the UK because this lockdown is not going to solve the problem. It's going to hopefully slow things down. It's going to buy us time to protect our NHS. It's going to buy us time for drugs and vaccines. But then we're going to have to figure out what happens next. And we could be a lot more effective at thinking about how we ease off on these really severe restrictions if we have really good intelligence about where the cases are, where things are going up and going down. And this is why Dr. Tedros, the head of WHO, has been saying test, 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 test is not the only thing you should be doing, but it's absolutely critical. We've heard over the last week, the Prime Minister and others saying almost every day at their press conferences, we're going to ramp up testing. But we haven't seen it reflected in the numbers since they made a conscious decision to almost entirely stop testing about 2 weeks ago, and that's concerning for me.
And is there more information on whether people who've had the virus are immune or immune for this season? Will there be a slightly mutated version of this like there is for the flu every year? Do we have any more information on what that could look like?
No new information yet. Conjecture, most people would wager, most sort of experts would wager that people who have been infected will get some immunity. There has not been any convincing demonstration of someone getting reinfected. There have been reports of this, but it's probably testing issues or prolonged shedding of virus. But I've not been convinced that someone's been infected with this novel coronavirus twice. So there probably is some immunity. How much, how long? We're not going to know that, unfortunately, for some time. And we only are just developing the ability to test for antibodies in the system, which is how you can sort of ideally get to be able to measure past infection and immunity. So we hope, but it's going to be really months before we have a better idea of what happens. It is important, and having the ability to test for antibodies will be important, because if we can at least conjecture that folks are going to have some immunity, it might give an opportunity, for example, for doctors who got sick and recovered to get back into the hospitals and get back to work, and that's going to be really important. One of the challenges of the way we're doing things in the UK is that, if you or I get sick with corona-like symptoms, we're just asked to stay home and keep our families home for 14 days. We don't know if we really need to stay home. We don't know if we really have it. We'll never know if we really got it, potentially. And so that's really difficult, because if I get sick and then I recover, am I at risk of getting it again or not? I don't even know if I had it in the first place. And so that just gives a lot of uncertainty to all of us.
I mean, I think linked to exactly what you're just saying, and equally to your comment about test. One of the questions is around, the death toll in the UK was 422 as of yesterday. Do you have any observations about the demographics and characteristics of that group? Does the data back up the hypothesis that it is actually affecting over 70s and that there are lesser deaths in younger age groups? Or do we just not have the data because people are not being tested? I guess it's a bit of a complicated nut there.
Yeah, well, we know that the actual number of reported cases is probably way off. We're at between 6,000 and 7,000 cases here, I think, in the UK. We assume that's at least 10 times the actual number. Deaths are probably more accurate. It's unlikely that a lot of people are going to sort of die at home and not be counted or not ultimately be tested and confirmed. There will be some. Overall, mortality rates and some of the demographics have been a little bit all over the map if you look around the world. And I think what I've learned in these early weeks of this pandemic is to not be too certain about anything. Because we've seen, for example, in Korea, which has a really elderly population, the mortality rate being very low, and in Italy, it's really, really high. We've seen in some places infection or hospitalization infection rates amongst health workers who are mostly young and healthy being really high. We had an 18-year-old healthy young person in the UK die of coronavirus yesterday. It was reported yesterday. So we know that it's happening across the age spectrum. So I wouldn't put too much stock. We know overall the risk gets much higher as one gets older, particularly above 60 and then 70, and that it's more significant for those with comorbid medical conditions of various types. But we do see at least some severe cases and some deaths in younger populations as well.
And I guess going back to how do we increase testing, because obviously this is going to be so important for us in terms of data projections for the future, who might have any sort of immunity, and how do we protect for future strains of this? How do we encourage increased testing? Are there ways in which I guess citizens can be involved in pushing the government to think about this? What ways in which can we get involved to, I guess, get everyone tested more quickly, or how can we help support?
seems to me, from what I can gather, we can't get a straight answer on this question, and I wish more journalists were asking it at the daily press briefings, why it's not going up. The only plausible explanations are that it's a decision not to, or it's about kind of resource limitations, and maybe we just want to focus our resources, our efforts on other things, and we're just too overwhelmed to do it. The tests exist. There are tests being manufactured in the UK and exported to other countries. You can't get a test if you're a health worker in the NHS with symptoms of coronavirus to this day, which to me is, kind of shameful and really short-sighted. So I think what I would encourage everyone to do is make some noise about this. I think that increasing testing and being much, much, much swifter about protective equipment for health workers are two things that we have to push government on. We know they'll respond to pressure because 2 weeks ago, when they announced a kind of half-baked policy of herd immunity and letting this spread through the population, a real significant pushback from both the scientific community, the media, and the public really, I think, did influence their reevaluation of that strategy and changing course. So make noise, call your MP, push journalists on this. And I think we at least deserve an explanation. Maybe there's something that I don't know. But these are two things that I think we need to be doing more of. Remember, we don't want this lockdown to last forever. This is about buying us time, and how are we going to use this time that we have to make sure that we can turn the tide?
And actually a question we've never asked before, but how is the virus affecting animals? Is it? There's been very little information about that.
So we know this virus, or we suspect this virus jumped over from animals, that it does live in bat populations, but doesn't cause disease in bats. They just harbor it as a virus, the way we harbor lots of bacteria in our GI tracts, and they don't, give us any issues. And that it does affect other animal populations. We don't have a lot of information, to my knowledge, about specific animal populations. I recall reading that dogs don't appear to be vulnerable to getting ill with this virus, but that's about all I know at this point.
And I guess hopefully lastly, another question come in, are there any updates on whether and for how long those not displaying symptoms but exposed to virus may be infectious to others?
We typically say the sort of course of illness, or the course from infection through recovery, is about 14 days, and that's why the kind of self-isolation period is 14 days. If you get sick and you're by yourself, that self-isolation period is about 7 days. It's shorter because usually it's about 4 to 5 days to show symptoms, and then it's about a week after that you should sort of get sick and recover. Now, of course, many people will start to get sicker afterwards. We don't know exactly. I would say that during the period when you're still having symptoms, still having fever, still having sniffing cough, still feeling really wiped out, there's lots of other symptoms we've been hearing about, like loss of smell and taste, sometimes GI problems. While you're having symptoms, you definitely presume that you're infectious. Typically, we'd say for other respiratory viruses, about 48 hours after you kind of mostly recover, you should be less infectious. We don't know for sure. These guidelines are based on the evidence that we've got.
And going back to animals and what you were just saying in terms of, I know you obviously don't have that much information, but seeing as we don't know, is it possible that kind of cats and dogs could be carriers? And should we be thinking about actually keeping our pets indoors?
Great question. I don't know. I don't know about the carrier question. I can look into it and we can talk about it tomorrow if you want.
I think that would be lovely. I guess one final question for you, and hopefully trying to stay on a positive note. So as you mentioned at the beginning, India is taking a big step today to kind of lock down several weeks before any other countries have done it in terms of similar cases. Does that give us a lot of hope, at least for kind of Asia, in terms of the spread of the virus, seeing as such a big country has decided to put itself into lockdown and control the spread of this?
Yeah, I think it's a big country that's showing that they've learned lessons from Asia and that they're following guidelines and trying to stay on the right side of this thing, which is staying a little bit ahead of the game, right? This is like a game of chess where you always need to think about where's the virus going to be in a week or 2 weeks down the road, because actions now won't have an effect for that amount of time. And that's why it's so smart to sort of do it early. we're at a moment right now where about a third of the world's population is on quote unquote lockdown, which is really significant. China continues to relax theirs a little bit. And in fact, Hubei province is ending their lockdown today after about 2 months. And then the city of Wuhan itself will have another couple of weeks before they start to ease up. But a third of the world population. So I think it's a significant step and a hopeful sign that India is trying to stay ahead of this. We've seen really aggressive action in sub-Saharan Africa. There are isolated cases. We can, cross our fingers they'll be able to contain this. But I think they're looking at Asia and they're looking at Europe and the US and saying, where do we want to be right now? And it looks like mostly making the right decision.
Brilliant. Well, I look forward to chatting to you tomorrow, Peter. Thank you so much again for your time. We will come back to the questions on animals tomorrow, hopefully with some new delved in information. Thank you, Peter, for doing your research on that ahead of time. But thank you all for joining us. Please save any other questions you might have for tomorrow, and we'll be back with Peter at 5:30 tomorrow evening. Thank you so much for joining us, and we hope you have a good evening.
Bye. Stay
Bye.
home.